Hey guys, this is Erin McCormick, and for my EMS Skills Lab, we are going to be talking about traction splint. Hey guys, this is Erin McCormick, and for my EMS Skills Lab, I'm going to be talking about the traction splint. Alright, so some things that we're going to go over. We're going to review the skeletal system, talk about the major bone involved in the traction splinting, the fractures, how to treat the femur fractures, indications for using traction splint and contraindications for using the traction splint. Take a look at the equipment with the traction splinting, and then we'll show you the procedure on how you're going to perform this skill. Alright, so there are 5 functions of the skeletal system. So we got movement. This system provides a point of attachment for the muscles. The legs and arms will move when the muscle pulls on the bone. Number 2, support. The backbone is the main support center for the upper body. Protection. The bone of your skull protects your brain, and your ribs protect your lung and heart. Number 4, makes blood. So your red and white blood cells are formed by tissue called marrow, and it is in the center of your bone. And number 5, storage. Bones store minerals such as calcium and phosphorus. There are 206 bones in the skeleton. Those are consisting of long bones such as the femur or the humerus, and the short bones like the carpals and tarsals. So here's a look at your femur bone, also known as your thigh bone. It's the longest and strongest bone in the body. So right there in your upper leg. And when we get a patient with a femur fracture, like you'll see in these pictures, it's going to be caused from a direct blow or a twisting force to the thigh. It's very painful, and you will probably see obvious deformity when you come across these patients. So with a complete fracture, the leg, the knee, the area, the hips will all be very unstable. And considering it's such a big bone and there's potential for a lot of pain and blood loss, this can produce a profound shock. So how are we going to treat this femur fracture? With the traction splint. So we're going to use the act of exerting a pulling force on the body structure in the direction of its normal alignment. So we're going to pull on that leg that's deformed, put it in the right alignment, and the goals of this traction is to stabilize the fracture fragments, align the limb again, alleviate pain, and avoid potential neurovascular compromise. Some indications for your traction splint are the severe mid-shaft fracture of the femur, any painful, swollen, deformed mid-thigh injury without coexisting lower leg injury. So if you got something else going on the ankle or the foot, you don't want to be putting it in a traction splint and pulling on those injuries. Or if you have any other life-threatening injuries, you don't want to take the time to be putting on a traction splint when you got other things to worry about. Some contraindications, so what we talked about, any injury that's close to the knee, any injury that is involving the knee, hip, or pelvis, and any of those lower leg injuries like I talked about. And this is the equipment with the traction splint. You have the hair and the Sager splint, so depending on what your department used, or you might possibly have both and can kind of decide which one's going to work better for you. And now I'm going to show you how you're going to perform this skill. This video is going to give you an example of how you're going to be tested out on this skill and what you want to do to perform the procedure accurately.
Challenge the natural order, Mr. Frankenstein. Look.
This station is designed to test an EMT candidate's ability to properly immobilize a midshaft femoral fracture using a traction splint. A second EMT will assist with this station. This station should take approximately 10 minutes to complete.
It takes more than one person to properly manage a femur fracture. This skill is not needed frequently, but when it is needed, it requires a coordinated effort to stabilize the leg Apply traction and secure the splint. Constantly talk with your partner so that there are no surprise moves that could injure the patient.
Candidates at this station will have the equipment necessary to successfully immobilize a simulated femur fracture. This includes a traction splint with ankle hitch, gauze pad to provide comfort under the ischial strap, and medical exam gloves as part of the necessary personal protective equipment. The main sections of this station are manual stabilization and traction, assessing the injured area, immobilizing the injured area through use of a traction splint, reassessing the injured area, and transportation.
Welcome to the traction split station. You've had an opportunity to check your equipment. Do you have any questions? No. Okay. You've done an assessment on your patient and you determined that they have a traction splint applied. So go ahead and show me how you would do that.
Begin the station by indicating that the proper personal protective equipment is being used.
I'm going to take proper body substance isolation precautions.
Working together, apply manual stabilization and manual traction to the injured leg. Assess for motor, sensory, and distal circulatory function.
I'm going to move to stabilize the extremity and direct my partner to check pulse, motor, and sensory function in the distal extremity. Change my hand position. I'm going to direct him to pull traction. Go ahead. Out. Up.
Measure and adjust the length of the splint against the patient's uninjured leg. Place the splint under the injured leg and position the straps. Apply the ischial strap securely. Fasten the ankle hitch to the splint and apply mechanical traction. Secure the remaining straps. And reevaluate the securing device. Reassess motor, sensory, and distal circulatory functions. Verbalize securing the patient to a backboard for further immobilization during transport to a medical facility.
How would you prepare this patient for transport now?
I would place the patient on a long backboard, securing the patient to the backboard and then the splint to the backboard. We're going to reassess pulse, motor, and sensory in the distal extremity. Still pulse. Can you move your toes?
The circulatory, sensory, and motor functions are present and normal at the time.
Reassesses vital signs, airway, breathing, circulation, and transport the patient to the closest, most appropriate facility.
The examiner checks the candidate's performance against the critical criteria for the station. Items at this station that would result in failure include failing to maintain proper traction once it is applied, failing to assess and reassess motor, sensory, and distal circulatory function, excessively rotating or extending the foot after the splint was applied, failing to secure the ischial strap before applying traction, and failing to support the femur or to prevent rotation of the injured leg.
Direct your partner throughout each step. Once applied, maintain manual traction until mechanical traction is applied and all straps have been secured.
All right, so that is it for my presentation. Thank you.